Welcome back friend. Today in this video I will discuss you about cross matching. What is cross matching, types, principle, procedures and interpretation we will discuss in cross matching. Already I make this video in Urdu and Hindi. If someone want to listen that video in that language, then you can click on the cards of this video and already that video also available. So now we will start about cross matching. What is cross matching? Cross matching is the part of blood banking. In blood banking, in blood banking we are performing cross matching test. And what is cross matching? Cross matching is a procedure that is performed before to transfusion of blood or any blood product to detect any serological incompatibilities. Serological means antigen antibodies incompatibilities in the blood of donor and recipient. Means we will check both blood of donor and recipient blood before the transfusion of blood or blood product to the recipient. And before the donor blood is transfused into recipient, there should be no antigen or antibodies in both that would react with each other, resulting in transfusion reaction. Means when we will check blood before transfusion, in that blood there should be no antigen or antibody in the donor or recipient blood that can cause the transfusion reaction. So cross matching is designed to prevent such transfusion reactions which may occur after transfusion because after transfusion, if any transfusion reaction will happen, that is not only difficult to deal but sometimes it lead to the death of the patient. So cross matching is very important test performed before transfusion. What is the importance of cross matching? Cross matching play an important role to detect and mostly recipient antibodies directed against donor red blood cell antigen. Second, donor antibodies directed against recipient red blood cell antigen. And third, major error if happened in ABO grouping like labeling, identification of donor or recipient. So we can rectify that error by doing cross matching. That first 2 points that I discussed, that most recipient antibody directed against donor red blood cell antigen and most donor antibody directed against recipient red blood cell antigen, these 2 points don't be confused with these 2 points because when I will discuss about the types of cross matching, then you can understand why in one point I used recipient antibodies but in other point I used the recipient red blood cell antigens. So before going to the cross matching types, just I will tell the principle. The principle of cross matching is based on the serological compatibility. Means if the recipient and donor blood is serologically compatible, that time after we can do the transfusion. But if that is serological incompatible, then there should be no transfusion we cannot do any transfusion to the recipient because donor and recipient blood show incompatibility. So now we will move toward the types of cross matching. There are two types of cross matching: major cross match and minor cross match. Major cross match, what is the difference between major and minor cross match? In major cross match, what we will do, in major cross match we will take the donor red cells and we will take the recipient serum, and then we will detect or determine the presence of any antibodies which can cause hemolysis or agglutination of donor red cells. And I will tell you that major cross match is more important than minor cross match, and mostly major cross match is performing. Why it's important? When we will see the results and interpretation, that time we can understand why the major cross match is more important than minor cross match, or why major cross match is playing more important role than minor cross match. But first of all, as a basic knowledge, in major cross match, it involve the testing of donor red cells with recipient serum to determine presence of any antibody which cause hemolysis or agglutination of donor red cells. Next is minor cross match. In minor cross match, it involves the donor serum or plasma with recipient red cells. Now, in the minor cross match, we will take donor serum and recipient red cells to determine presence of any antibody which may cause hemolysis or agglutination of recipient red cells. So now if you will focus on this major and minor cross match, in major cross match we will take donor red cells, but recipients we will take serum or plasma. But in minor cross match we will take donor serum or plasma and recipient red cells. So this is a very important point, not only for cross matching but also for interviews and viva or MCQs. Sometime in MCQs it will come, it will be written as in major cross match what we, if donor red cells available, then what recipients you will use. Then you can answer serum or plasma. But if option is serum, then choose serum. If option is plasma, choose plasma. And they can ask that what is the difference between major and minor cross match. That time you can reply that in major cross match we will take donor red cells and recipient serum, and then we will check the presence of any antibody that can cause hemolysis. But in minor cross match we will take donor serum and recipient red cells that can cause then we will check for an presence of any antibody that may cause hemolysis or agglutination of recipient red cells. Now we will go to the procedure. And there are different methods or procedure of cross matching as written below, but the most common technique or most common procedure or most common method we will use is anti-human globulin cross match method. As you can see, there are three methods of cross matching: saline cross match, albumin cross match, and anti-human globulin cross match. In saline cross match we will detect the antibodies. Which type of antibody we will detect? It will be IgM. In albumin cross match it will detect IgG, and in anti-human globulin cross match it will detect IgG also. And as I told before, the most common method we will use is anti-human globulin cross match. Now first we will see the procedure of major cross match, then we will go to the procedure of minor cross match. After that we will see result and interpretation. Now first we will see the procedure of major cross match. First of all, we have to prepare the blood samples of donor and recipient. As I told before that in major cross match we will take donor red cells and recipient serum we will take. Red cell means red blood cells. Now from donor red blood cell, first of all we will prepare 3 to 5% saline cell suspension. After that we will move toward the procedure. So basically you need donor red blood cell, that is 3 to 5% suspension, and recipient you need serum. Now you have to label your test tube by patient name. After that what you will do, you can add 2 drops of recipient serum and 1 drop of cell suspension, and that cell suspension is donor cell suspension. So in tube you will add 2 drops of recipient serum, so recipient serum quantity will be double, and 1 drop of cell suspension. After that mix and just incubate the tubes at 37 degrees centigrade for about 60 minutes. After that step number 6 is we will decant the serum completely, and then we will wash the cells 3 times with saline. Step number 7, what we will do sorry, we will add 2 drops of anti-human globulin and then we will mix. Then we will keep it at room temperature. We will allow to stand for 5 minutes. After that we will centrifuge that tube 1500 rpm for 1 minute. and then we will observe, means 50 after centrifuge we will observe that tube macroscopically and microscopically for agglutination. Macroscopically means with your eye vision, and microscopically means under the microscope. If there is no macroscopic agglutination, means with eye, if you not see any agglutination, then you will go toward the microscopic uh, check, means you will check agglutination in microscope. So how we will check in microscope? Just you can take one drop from the tube and keep on the slide and observe under microscope. If you will see the visible agglutination, that means the donor and recipient blood is incompatible. But if you will not see any visible agglutination, that means donor and recipient blood is compatible. So now when you will see the when you will see under microscope and you are watching that there is Rolex formation also, Rolex red cell is there. Do not consider Rolex red cells as what I will say, that agglutination. Rolex RBC doesn't mean agglutination. So only if visible agglutination, if you will see clumps, or as I already make one video also how agglutination seen in under microscope, that you can watch. So only that agglutination means that blood is incompatible. Otherwise it means that if there is no agglutination, it means blood is compatible and we can transfuse donor blood to the recipient. But if there is agglutination, it means that there is incompatibility and we cannot transfuse this donor blood to the recipient. Now by this diagram also we can understand the procedure of major cross match. Now you see, we will take, as I told, that 2 drops of recipient serum, and we will take 1 drop of donor RBCs, that is 3 to 5% red cell suspension. After that, in one tube, when we will take 2 drops of recipient serum and 1 drop of donor RBCs, we will incubate 37 degrees centigrade for 1 hour. After that we will do 3 time washing with the saline. After that, in that wash tube we will add 2 drops of anti-human globulin and we will allow to stand for 5 minutes. After that we will centrifuge. When we will centrifuge, after that we will observe for agglutination. If there is agglutination, as you can see above the tube, then it means that donor and recipient bloods are not compatible for each other. And if there is no agglutination, it means they are compatible for each other and we can transfuse the blood. So with this diagram also can understand the procedure of major cross match. Now we will move toward the minor cross match procedure. In minor cross match we will prepare donor and recipient blood sample first of all, but now we will take recipient red cells and donor serum. After that procedure is same only, but now for recipient red cells we have to make suspension. Before we in major we took donor red cells, that time we also make suspension. Now from recipient red cells we will make suspension. Now we will label our test tube. Now we will take 2 drops of donor serum but 1 drop of recipient cell suspension. After that, same procedure as it was in my major cross match. We will mix and we will incubate at 37 degrees centigrade for about 60 minutes, means 1 hour. After that, decant the serum completely and wash the cells 3 times in the saline. Then step number 6, after washing we will add 2 drops of anti-human globulin and we will mix. After that, step number 7, we will allow to stand for at room temperature for 25 minutes and then we will centrifuge at 1500 rpm for 1 minute. After that we will observe for agglutination macroscopically and microscopically. And same, if there is no macroscopic agglutination, then just transfer small amount of that on glass slide and they just examine under microscope for agglutination. And again, Rolex is not indication for incompatibility or agglutination. Now we will see how to read the results and how we can interpret the results. Before going to result interpretation, I will show you diagram for minor cross match. In minor cross match, as we told, the donor serum we will take 2 drops and 1 drop for recipient red cell suspension, and then we will incubate 37 degrees centigrade for 1 hour, and then we will do 3 time washing. Before 3 time washing, we will decant the super serum, and after 3 time wash we will do with saline. After that we will add 2 drops of anti-human globulin, and then we will centrifuge for 1 minute at 1500 rpm, and after that we will observe the agglutination. If there is agglutination, it means the donor and recipient blood is incompatible, they are not compatible and we cannot transfuse. But if there is no agglutination, it means the donor and recipient blood is compatible to each other and we can transfuse. Now we will move toward the result and interpretation. Compatible donor and recipient blood, how we will see. Compatible donor recipient blood should show no agglutination, either in major cross match or in minor cross match. Means both procedures should show no agglutination. It means that they are compatible for each other, donor and recipient blood. If blood which shows incompatibility in major cross match should never be transfused. Even the minor cross match also should never transfuse. But when we are testing a major and minor cross match, why we are saying that major cross match is more important than minor cross match, or it's better to perform major cross match than minor cross match? Because as you noticed, in major cross match we are taking serum, recipient serum, and that recipient serum volume is more. Means, as you remember, in procedure we take 2 drops of serum and 1 drop of cell suspension. So when there will be large volume of serum, it contain more antibodies. So if when the blood will be incompatible, means when donor red blood cell containing antibodies sorry donor red cell containing antigen that are incompatible, that time the antibodies present in the serum, they can quickly hemolyze because they are more in volume. So they will hemolyze and destroy the red cells, and then it's very easy to judge, and it's very easy to take decision that donor and recipient blood is incompatible. So in major cross match, as I told, that recipient serum we will take, and recipient serum volume, you remember, it is 2 drops, so it is containing more antibodies. So if it is donor red cells containing antigens that are not compatible, that time these antibodies, they will destroy the red blood cells and it will cause agglutination. But in minor cross match, what will happen, that minor cross match incompatibility is little less important, because in that we will take donor serum and recipient red cells. So if donor serum contain antibodies that will dilute in the recipient plasma, then making the antibodies very dilute. So antibodies will dilute and it will make ineffective, or we can say that not give result as like major cross match. So major cross match is more important than minor cross match. But our final result is what? Our final result means that compatible donor and recipient blood should show no agglutination in both major and minor cross match. So if any visible macroscopically or microscopically, if any agglutination is visible, means the their blood is incompatible. But if there is no agglutination either macroscopically or microscopically, it means that their blood is compatible. So this lecture is going to complete here. I hope you understand the concept of cross matching, procedure of cross matching, and how we will take the result of cross matching. And I hope if any question related to it, by it will come, or in MCQs it will come, this lecture will be helpful. So this lecture is completed here. I will meet you with new lecture, and take care of yourself. Thank you so much.